Hello, I got a request to talk about how to start your health journey for beginners, and I'm super passionate about this because we are all a beginner at some point. I say that in air quotes because we all deserve to pursue health and to be healthy no matter what size or shape we're at, no matter what kind of upbringing we had around healthy habits, right? But we all kind of make a conscious decision, or most of us do at some point in our life, and kind of say, okay, I care about health and wellness. This is one of my values. Being healthy and living a rich quality of life and a long life is important to me. So you have to start kind of making decisions that align with those values. Um, and like I said, I really firmly believe in the health at every size approach, which essentially means that anyone of any size and shape is worthy of the pursuit of health. Um, there aren't any entry requirements, right? Like, this is your life, this is your personal journey. It doesn't matter. It just matters that this is now a value to you and you want to make some changes, which is amazing and a beautiful thing. The first place I would start is to look at your healthcare team and really make sure you're on top of your appointments, that you've gotten recent lab work, and you know everything that's kind of going on inside. And this way we have a really good baseline to start from. How are you going to make personalized health decisions or work with someone like a dietitian, for example, if you haven't gotten your cholesterol level checked in 10 years? Just an example, but you get my point. So it's really important to find a good primary care physician. Um, have your full healthcare team. If you need a mental health specialist on that team, whether that's a therapist, psychiatrist, you may need a dietitian. Someone like me, you might need different specialists based on certain medical conditions that you might be living with. So this is very personalized to you. Make sure you're on top of those appointments, and then you have recent labs done. And then the biggest thing with this sort of health journey initiative is to really think about starting small. I think a lot of times we get this kind of fire under our belly and we go, okay, I want to change everything. I want a new lifestyle. I want to overhaul everything I eat, every like the type of exercise I do. It is just like you get really excited and fired up, which is amazing. But we do have to remember that our health outcomes are all based on our habits, right? We always fall back to our habits, and habits take time to build. They're not built overnight. And so we have to look at how we can change and modify the little things we do throughout the day that we can stick with and be consistent with. And starting small and working at this incrementally is the best way to do that. So, what I mean by that, we have kind of these different categories of our health, right? We have physical activity, we have nutrition, we have sleep, and many more. But just to keep it simple, we can start with physical activity. The best way that I would say, if you're like a total beginner and you've not exercised in years, I would just suggest that you start walking. That's the easiest thing. We all, pretty much all, have access to walking. If you've got injuries or mobility limitations, most of us are able to walk, which is why I gravitate to walking first. I know not everyone can, but this is something that you can generally do without too much conscious thought. You can also just think about different ways you can like add movement and increase activity throughout the day. So for example, if you're working an office job where you're sedentary for 8 hours at your desk and you're not moving much, just try to think of a couple times a day where you can stand or maybe take a call and pace around. If you work from home, throw a couple loads of laundry in throughout the day. Find reasons to get up, take the dog out for a little bit longer of a walk at lunchtime. So these are little ways that are kind of like, you're kind of habit stacking here, and pairing physical activity with chores you're already needing to do or work tasks that you're already needing to do. That can gradually increase your step count, assuming that you're tracking steps. You don't necessarily have to even track steps or use a fitness tracker to to hit these goals, right? If it is something like walking, another way that you can implement this is to just try to make a small twice a week for 15 minutes. I always say too, like if you're able to just do a very small time bound goal, even if it's like 5 minutes, 10 minutes, something very short duration that at least gets you out there, right? That at least gets you to put your tennis shoes on and go outside or go to the treadmill or whatever equipment you're using. So having those really small goals helps you to create that habit, and then you build and build and build over time. You can increase duration, you can increase frequency. So for physical activity, that's where I would start. For nutrition, assuming that nutrition, a lot of times when we're getting started, nutrition might just be all over the place. There might not be much of a framework there. Nutrition is very personal based on your individual set of needs. So I always recommend consulting with a dietitian or nutritionist, someone like me. But if you don't have access to that just yet, a couple of things that you can go ahead and change off the bat are making an effort to cook more in the house. So a lot of times when we're struggling with nutrition, we are getting food out, getting food to go, heating meals up in the microwave, which are not inherently bad at all. We really require a mix for convenience and just living a normal life. I'm not saying you have to cook every single meal. I don't. But cooking more might be a great way to increase the nutrition and quality of the foods in your overall diet. Another way that you could improve your nutrition with just a really small goal is to try to think of like 1 to 2 vegetables that you could add a day, right? If you're not eating very many vegetables right now, this is a great way to increase fiber, to increase nutrients, vitamins, minerals, antioxidants. It's kind of a no-brainer, right? Most of us can eat vegetables and they're really good for most of us. So that's why I kind of throw that recommendation out there. And then hydration is also a huge part of your nutrition status. So look at the beverages you're drinking, and try to drink mostly water if you can. You can always flavor your water if you don't prefer water. And a good rule of thumb for hydration is to try to drink about half your body weight in ounces each day. So, for example, a 200-pound person needs around 100 ounces of water a day, maybe more based on activity levels. But that's kind of a good rule of thumb for hydration. You can also start incrementally there as well. So even if you have this goal of 100 ounces a day, back to that example, if you're used to drinking more like 24 ounces a day, let's just up it to like 48. Try to double what you're doing right now. There's no sense in trying to go for this drastic change when you may not be able to stick with it, right? So just do it incrementally. And then my last little talking point as far as health habits go is to look at your sleep, your length of sleep, your quality of sleep. If you wear a fitness device or if you're wanting to purchase one to start your health journey, you can track sleep this way. Sleep is literally the cornerstone of your health. If you're not sleeping, it's all of this is kind of in vain, right? We have to sleep. That's where our body recovers. And so many other important functions happen while we sleep. If you feel like your sleep is not up to par, if you feel like you're really struggling, go to your PCP, talk with your primary care provider, and discuss a sleep study. Let them know what's going on. Sleep apnea is super prevalent, so it's always good to sort of screen for that and have a sleep study done. It's just good to have these open conversations with your healthcare team. That circles us right back to why it's so important to have a really good healthcare team that you trust. I know that a lot of times when we're wanting to start our health journey, it's unfortunately because there has been sort of a drastic health event, whether it was something that directly happened to you or impacted someone you love that sort of woke you up. I know this can be such a catalyst for a lot of people. Um, and I know that that can feel scary, and I know that can feel hard to digest, like big news or a new diagnosis, or if you are struggling with your weight. I know that these can be lifelong challenges, and there are so many mental barriers that go along with these changes. And I would be remiss if I didn't mention this, and that's part of what I do as a dietitian with my clients is work with them through these mental obstacles, these barriers, their feelings, their emotions as they journey through their nutrition, health, and wellness. So I hope that sort of validates where you're at if you're someone who's identifying as a beginner. And I wish you the best of luck. My email inbox is always open. My social media messages are always open. If you ever need someone to just chat, it can be a scary, isolating feeling, but at the same time, it's such an opportunity, and it's so exciting to think of how your life could change and how beautiful that can be and how that can impact your relationships in such a positive way, can impact your career in such a positive way, impact the things you love to do, your hobbies, if you like to travel. I mean, it opens so many doors for you when you are healthy and you feel good and you genuinely have that energy and that zest for life. There's like nothing beats that. So I hope this helps.